Everything you need to know about acne from a doctor's perspective. Hi, I'm Dr. Sara and I practice aesthetic medicine at NuDerma MedSpa. Let's start with how acne actually works. So every acne has to do with the sebaceous gland, which is the oil gland, and it also has to do with the epidermis, which is the outer layer of the skin. Lastly, there's always a pore involved or the shaft of a small vellus hair. Those three components are the root cause. And notice how I didn't mention bacteria just yet. In most people, the androgens, also known as hormones, alter these factors. So for example, they affect the epidermis so it doesn't shed as well, and it also changes the oil production, making it thicker and stickier. This leads to a process known as comedogenic, or the formation of comedones. We always think of whiteheads and blackheads. Whiteheads is when the surface of the skin is closed, but the oil production underneath is abnormal. And blackheads is when that surface opens up, but then the oil becomes oxidized, making it turn black. So in this photo, you can see the blackheads on the bottom and the whiteheads in the top photo. So when patients come in and they go, wow, look at all my acne red areas, I focus on this because this shows me what's going to happen to them in the future. Because these comedones go on to rupture and become pustules and nodules. Now, it's important to remember that comedogenic, the formation of those white and blackheads, takes 6 to 12 weeks. So that acne, even though it blew up overnight, had already been kind of fermenting on your skin for a while. Your diet also plays a role, such as eating sugary foods. They figure this out through Japan, where people are now starting to adopt a Western diet and faced with way more acne than before. On the flip side, omega-3 fatty acids have been shown to suppress acne. Now, moving on to medical management, remember that this comedogenic took 6 to 12 weeks to start forming, so therefore, it'll take 6 to 12 weeks for any of these meds to start working. And you have to do the entire face, not just where you have red spots. So now to stop the actual comedones, you have to do a few things, and I usually use a combination of these treatments. So chemical peels and extractions are done in office, benzoyl peroxide, which acts as a chemical peel and as a slightly antimicrobial agent, liquid nitrogen cryotherapy, which is also done in the office, and then also vitamin C and retinoids. They both act like mild chemical peels, and retinoids also help with cellular turnover. Now, stopping step 2, which is the actual pustule formation, which everyone actually cares about, is done with antibiotics, either oral or topical, and it has to be done with prolonged use because they have to be sitting and waiting on your skin for at least 6 to 12 weeks during this entire treatment phase. Lastly, I'm going to bring up Accutane, which has to be used very carefully, but it does help with cystic acne and it helps with step 2 and step 1. There are also some special subtypes like adult female hormonal acne, which is very common. So these patients will be starting on spironolactone. If you have deeper nodular cystic acne, sometimes I put them on steroids. Now, lasers are becoming more important as treatment options because a lot of people can't be on some of those meds. And they also replace the need for a lot of those meds. They reduce inflammation, reduce red and brown pigmentation. I use them to kill the bacteria directly, and we now have some lasers that actually can target your sebaceous glands and reduce the oil on your skin. So each treatment plan is a combination of prescription, over-the-counter, and interventions.